And so you have to follow ethical behavior practices and not unethical practices.
A warm welcome to all of you. We are the people of hope. Only we'll have to see how we could do best.
Hello. Very good morning and a warm welcome to everyone present here. I'm Lekhan Maria.
And I am Stella. We will be the MCs for today's program. We will be guiding you all in celebrating the Jubilee for the sick and healthcare workers.
These sacred occasions bring us together in faith, gratitude, and solidarity to acknowledge an invaluable role of healthcare workers and to extend our prayers and support to the sick and suffering. We are especially honored by the presence of Most Reverend Dominic Emeritus, Archbishop of Imphal, Reverend Father Ivan Santosh, CBCI Catholic Bishop Conference of India Secretary Health Commission, Reverend Father T.S Dominic, Parish Priest Awangkhul, Reverend Father James Tangshel, Director CMC Hospital, Dr. Benedict Maring Ayus, State Nodal Official Manipur, Reverend Fathers A.C. George, Dr. Asiko, Madam Dalison, and Sister Alice. As we begin this meaningful celebration, let us open our hearts to God's grace, drawing strength from one another and renewing our goal to serve with love and compassion. May this Jubilee be a time of healing, renewal, and abundant blessing for all. We extend our heartfelt gratitude to our esteemed dignitaries for your presence and for leading the auspicious beginning, wishing the light of the Lamp guides everyone towards wisdom and understanding.
It is my honor to invite Reverend Father James Tangshel, Director of CMC Hospital and College of Nursing, who will deliver the welcome address.
A very good morning to everyone.
Your Grace, Most Reverend Dominic Lumon, DD Archbishop Emeritus, Reverend Father Santosh Beas, the Secretary to the Health Commission, CBCI, Reverend Father K.C. George, former and the founder of NEJA, Director, Reverend Father Thomas, the Chaplain, dear doctors, nurses, staff and students, and a special welcome to all of you. Just now we have witnessed the lighting of the lamp, representing from the doctor's side and from the CNGI Manipur branch and also CHAM. Sister Anis represent CHAM which means Catholic Health Association of Manipur, CNGI Catholic Nurses Guild of India Manipur branch by senior nurse Ma'am Delisan, and of course from the doctors fraternity Dr. Rashiko, the senior most at present, and those are present. So, and of course together with our Archbishop Emeritus and the Father Santosh and Father K.C. George, all of us have did the lighting of the lamp, which is formally inaugurated. Having said this, a warm welcome to all of you, and let us give clap to all of us ourselves. In fact, the initiative took place rather in a short notice time, and we have been banging to all our nurses and doctors, you should be present, like a AK-45 pointing them. We have been requesting them, even though they are willing to come, but our delay in inviting them, despite all their program scheduled in advance, they have made themselves. And to you, dear doctors and nurses, and dear healthcare workers, we wish you a very happy Jubilee. As simple as we are today in the diocese, we organize this, and we are privileged and grateful to Reverend Father Santosh, whom I met a few weeks back. He happily accepts our invitation to deliver a talk to us and also to see how Manipur looks like. Father Santosh seems to be visiting Manipur for the first time, and I'm happy. A first visit should be a good impression, yet it's up to him, and we give our best impression to you, dear Father. And while welcoming everyone, a special welcome to Father Santosh. I am not very formally going, yet I go here and there. As I thought, my mind goes here and there. Forgive me for that. A joy as we are healthcare workers, today we gather not only to celebrate, but to reflect, to honor, and to reaffirm our commitment to compassion and care. This Jubilee year is a time to pause and acknowledge the remarkable dedication of our healthcare workers. For decades, you and I have been, or you have been, the pillars of strength, the hands of healing, and the hearts of comfort for countless individuals. Your unwavering commitment, especially in times of crisis, has illuminated the path of hope and resilience. You have faced challenges with courage and extended kindness with grace, and embody the true spirit of services. We also remember and call in our hearts all those who have borne the weight of illness and suffering. Their strength, their vulnerability, and their perseverance have taught us invaluable lessons about the human spirit. This Jubilee year is a testament to their journey, a recognition of their resilience, and a prayer for their continued well-being. This we say to all of you, the health workers, and to the sick. And the celebration is an opportunity to once again express our gratitude to all healthcare workers who work tirelessly in the healthcare sector, and your selfless service and often perform under challenging circumstances is a beacon of light in times of darkness. It is also a reflection on the profound significance of compassion and empathy in healthcare. The human touch, the listening ear, and the comforting presence are as essential as medical expertise. And also it is a time to acknowledge strength and resilience of the sick, who face their challenges with courage and dignity. Their stories inspires us and reminds us of power of the human spirit. It is also a day, a renewed commitment for all of us to supporting and advocating for the well-being of both the sick and those who care for them. We must strive to create a healthcare system that is accessible and equitable and compassionate. This Jubilee year invites us to look deeper into the meaning of care, to understand the profound interconnectedness of human suffering and healing. We have heard many times said, Pope Francis said, a time spent with the sick is an holy hour. To you, dear doctors and sisters, nurses, and all of you, you are always with the sick. And you can imagine if we have to take this word, the time spent with the sick is an holy hour. You are in the presence of God and in place of God, in fact, and the process of healing that you have. It is indeed a touching moment, as we have heard, and I extend all of you a hearty welcome. To show our gratitude, I would like to, at the end of this welcome notes, invite a few leaders of ours present here to show our love and welcome and also recognition. I first of all invite His Grace Most Reverend Dominic to come over to the stage and accept a little bouquet and also a muffler. Your Grace, please. I request Reverend Father Santosh Ivan Dias to be on the stage to accept our welcome bouquet and muffler. I invite Reverend Father Casey George on the stage for a bouquet and a muffler. Next, I invite Dr. Ashiko on the stage for a bouquet and a muffler. I am making this bouquet and this one last to wait for Father T.S. and I got it the time. I request Father T.S., the second speaker on the dais, for a welcome bouquet and muffler. I request Madam Neli's son, the senior nurse, to come out on the stage for a bouquet and a muffler. I request Sister Annie's FCC on the stage for a bouquet and a muffler. Once again, I extend a heartfelt welcome to each and every one of you. Your presence here today amplifies the significance of this occasion, and let us make this Jubilee year a beacon of hope, a testament of resilience, and a celebration of compassion. Thank you.
Thank you, Father James Santosh, for delivering us the welcome address.
From far and near, weary to learn of Jesus here. Your radiance born, whose every life is filled with hope and joy divine. May our endeavor bend, now gathered in His name. United heart and hand, go forth to spread His fame. Then firmly let us stand for good and native land, and pray that He may bless and keep our Christian friends. We gather here, where all may sing glad songs of praise to Christ the King, where youthful hearts may find a way that leads to life and amazing. May our endeavor bend, now gathered in His name, united heart and hand, go forth to spread His fame. Then firmly let us stand for God and native land, and pray that He may bless and keep our Christian band. The Master's word will still pursue, and here again our pledge renew, to follow Him, to trust His love, and gather home with Him above. May our endeavor bend, now gathered in His name, united heart and hand, go forth to spread His fame. Then firmly let us stand for God and native land, and pray that He may bless and keep our Christian land.
Good morning to all of you. Dear Bishop Dominic, Father Thomas, Father George, Father T.S, Father James, Father, we came to the Bishop's office today to meet you. My dear sisters, my dear doctors, Father Paul also is here. My dear all the nurses and the healthcare workers. First and foremost, this is a Jubilee celebration. Therefore, as I begin my talk, I am very sure that I am speaking to the people who are really dedicated and committed people in the church. I salute all of you, including the bishop, and all of you, for all the commitment that you have, all the dedication that you have for the healthcare in the church. And most of us are also working in the healthcare centers of the church, the diocese, and in the church, and many of you are also working with the government and with the private sectors also. I seeing all of you doctors, nurses, and health workers, I really feel very proud. At the same time, I really feel very happy also to address you at this moment. For me, more than my talk, at the same time, I'm very sure whatever that I'm going to share with you has been the part of your life also most of the time. A few things maybe I'll be sharing, which we will be trying to know what is happening around. Manipur was a dream for me to come someday, but I was not sure. In 2001, there was one colleague I had in Koirengei International Institute in Canada while I was studying. Then onwards, I was always dreaming one day I should visit Manipur. God gave me an opportunity where, as I visited most of the regions of India, trying to know what exactly is the context in which we are giving our healthcare services, particularly we as church. Thanking all of you, especially Father James and the Bishop Neli, and all of you, thanking for being present here at this moment, and thanking for all the work that you do during this Jubilee year. I'll be keep praying for you all the time, more these days, and I'll be keep continue praying for you all, for all the good works that you do in the name of Jesus. As you see this picture, you see two kinds of pictures that you see. One is Jesus touching a person with leprosy, a person infected with leprosy and affected with leprosy. Jesus is touching and having compassion. Sometimes we find people and we take the place of Jesus. Sometimes we are the other side and we see Jesus. People who receive the services from us, receive the same love from us. You become another Christ in the church. Giving and presenting Him. Most of the time they have not said, you are like God came in my life. They would say, I feel that you are the God. You who helped me, you who supported me. I didn't know to whom to go. You helped me. They see us. And sometimes it puts us to feel very small about us. What much I have done, we feel. But to a person, in times of difficulties, especially when a person is sick, even for us, all of us, we find no one is there at some moments. And we find when someone gives a service, and that too especially in the church, that makes a difference. The other side, we see Jesus. Another picture is we serve every day. And we give the same Jesus to them. And I call for all of us in the church to be like Jesus. We are in the year of Jubilee. And the synod is over. During the synod, Pope gave a call to all of us The Holy Year is an opportunity to change our life, reevaluate our thinking, and start anew by learning from Jesus and placing our hope in God. So we learn always from Jesus and we hope in God. This is the meaning of the Jubilee pilgrimage. We are people with lots of hope. Often, many rules and regulations sometimes tell us that, it's going to be very hard in the days to come to serve. It's going to be very difficult in the days to come. But at the same time, we are the people of hope. Only we'll have to see how we could do best. Just now we were discussing, myself and Bishop Dominic. We keep on doing. We keep on finding the strategies. How best we could serve the people of India, people of our own surroundings. What best we could do. We should never say something is a hurdle is on our way, because every hurdle has to be turned into a new strategy. Every hurdle is a learning and to go ahead. Therefore, an invitation for all of us to change your life, change your thinking, change your attitude, and also to think and start new once again, every moment, and learn from Jesus, hope in God. My dear brothers and sisters, I salute you for all the work that you do. You represent, one or the other way, you represent Jesus to the people. For us, for the health work, especially for the Christians, for the Catholics, Jesus is the model. For the ministry that we do, particularly the healing ministry that we do. From the beginning, proclamation of the gospel was accompanied by the healing of the sick, from the beginning of the church. And therefore, the healing ministry as an essential part of the mission of the church. It was not something different. As we proclaim the good news, we have also done the healing ministry. The words of Jesus Christ have been the inspiration for Catholic care. I was sick, Jesus said, and you cared for me. We read it in the Gospel of Matthew. From the early church, Christians have tried to take care of the sick from the beginning of the church. The Council of Carthage stressed three things. One is, that was in the year 309. Visiting and healing the sick was fundamental aspects of Christian ministry. We cannot think of proclaiming the good news without doing the healing of the sick. Second, the council those days said, provide and support to those afflicted by illness. We cannot forget the people who are ill, physically and in every way. Reflecting Christ's teachings on compassion and love, to provide them compassion and love. So, provide them aid and support. The Carthage said, the council said, provide them. Third one, it was the council said in the year 309, need of physical healing as an integral part of spiritual care and community life. It has to be part of our ministry. It cannot be otherwise. Then the council tours. It was in the year 567. There it was said, the clergy and laity to visit and provide aid to those afflicted by illness. The council took a decision that we need to, the clergy and the laity, all we need to visit and give aid and provide support to those who are suffering, those who are in ailments. It also promoted, in the year 567, hospital and care facilities those days, reflecting Christian values of the compassion, charity and care of the vulnerable. This is the value that we have as a Christian value. We say compassion, charity and care of the vulnerable. Saint Basil is the one who established basilates. And those years, he said, we should have institutions to provide care for the sick, give them aid and support, give them shelter, those who are orphans and those who are sick, those who are widows, those who need, everyone should find all the support in the institution. So he started bachelors. Bachelors were where the healthcare centers were there, taking of the care of the people, providing them shelter, giving them food and aid, giving them, supporting them. And he started those bachelors. And later, those became the small hospitals. The concept of hospitals started in the church. And thus mainstreaming the sick become one of the priorities. In the year 1513, the Portuguese missionaries, we find that first time they started Santa Casa da Misericórdia. That is Holy Houses of Mercy they started in Lisbon, Portugal. And later they started also in their colonies, especially in the colonies like wherever they were in Brazil, in Africa and in Asia. They started the Holy Houses of Mercy. In India also they started in Goa and in Kochi. And these Holy Houses of Mercy later became the hospitals. The main thrust of those were, when it was started in the year 1513, were to provide health care, medical care and hospital structure, support the poor, distribute food and clothing, and care of the orphans those days. So these Holy Houses of Mercy were started by Portuguese officials when they were here in India. And later they became the hospitals. From then onwards, the healing ministry made a steady progress and served the poor sick people continually in India. The healing ministry in the church speaks volume about the Christian dedication and commitment to serve the poor and the sick people. It is also worth noting, in India, all the healthcare facilities that we have, 85% of our facilities are in the rural areas. And this is how in the church we take care of the people who are marginalized and those who are sick. The theological foundation that we have, we are all as Christians, as Catholics, we give Jesus to those who are sick. What is that makes us? What is that the church speaks? One is that Father T.S will be telling us more about it in the next talk. But at the same time, I would like to say the value of human life we mean. From the birth, we respect the life. From the moment of conception, the life of every human being is to be respected in an absolute way. God alone is the Lord of life from its beginning until its natural end. We have nothing to do in the life that God gave. It is to be respected and it is to be nurtured. The value of human life has to be always given importance. The second one is holistic view on the human person. That Jesus did not teach cult of suffering. Jesus did not say, let persons suffer. No, he said the suffering people has to be helped. And therefore, he healed the sick, consoled the afflicted, fed the hungry, freed the people from deafness, blindness and leprosy. The third one is solidarity with the sick. We are called to be the voice of the people who are sick, people who are suffering, people who do not have voice. And that is being done in many of the things that in the church in the past years. We were the pioneering people, the church in India, the pioneering church that told and gave model to the government how we could help people who are with life-threatening diseases. And such were the leprosy, HIV/AIDS, tuberculosis, and the later days recently, even with the COVID, the church involvement. Healthcare is an apostolate. This is what exactly I felt that I need to share, and Father James and myself will be saying, you are doing an apostolate. I'm not something telling now you are going to do. No, you are already doing it. Let's see what that is we are doing. We may not have much analyze at all our services. But people see that to each one of us, as Christians, they say, you do it with difference. They look at our face and say, you're Christians, right? You are a Catholic, right? Something different than the others. In our ways, in our approach, in our dealings, in every way that we serve, something is different. What is that? And that is there deep in our heart. We consider that the service that we give is something beyond that others do. We consider that it is an apostolate. What it is? A calling to spread the teaching of the church and serve others in faith. All that you do with faith, others follow us. Others try to imitate us. You know, a famous doctor, also in Narayana Netralaya, Narayana health centers, you know that it is they have in India. Dr. Devi Shetty, he says, before, as I come to the office, I kneel down. For me, as I know that along with that, somebody is a model, is a Mother Teresa. She served the sick as Jesus did. Therefore, I bow down, I kneel, pray, and then start my work. And we are all the time, we think that we are Christians, Catholics. We are much more than that, right? We are the model in the church today. Therefore, they always find a true Christian health worker is the person with compassion, love, and caring. Healthcare is an act of service and healing rooted in Catholic tradition. Tradition only it is rooted. The significance of healthcare in the church is a commitment to physical, emotional, and spiritual well-being. So therefore, it is an apostolate that we do. What is the apostolic dimension of the healthcare? You see the picture. Last Sunday we had the gospel where in Jesus healing at the Bethesda pool near Sheepgate, Jerusalem, showing compassion for 38 years. A person could not get into the pool, and after healing, the person did not know who healed him. He did not know. Then they asked him, "Who healed you?" "I don't know, someone." Then Jesus meets him in the synagogue, and then Jesus tells him, "Do not sin more." Then he says, "You are the one?" Then he goes and tells, "It is Jesus who healed." Most of us, we do not know to whom we are healing every day. Am I right? Many times you wouldn't ask their names. You do not know religion, caste, creed of theirs. But you know that what service you are doing. That you do it because something burns in you, those values. Because our health centers in the church need doctors. Your voluntary service are always welcome. Many of the health institutions, sisters and priests, keep calling, "Father, if you know any doctor, please send. We are struggling." Or what has happened, St. John started sending with the SOS, social obligation or rural bond. You are aware, many of the doctors, every year they send 150 doctors for the rural bond, for 1 year and 2 years of service. They do, but how much? We have around 3,700 health centers. In some places only we need around 349 health centers registered with St. John's asking for the doctors. They are sending as many as. Today also that's not easy. The doctors who finish their MBBS and then internship, then they go for rural bond. Easily they don't go to a very challenging place. They would see like where there is a tourist place, where there is sometimes there is like beaches, resorts and all such, or close to my house and all that. Sometimes it happens, no. But at the same time, we really in the rural areas, we need the doctors. CBCI governing board has taken a decision that every year, out of 150 seats in St. John's, particularly for the Catholics, St. John's has 150 seats for Catholics. For your information, please every year promote our Catholics to take up the seats there in the medical college. Make use of this. Particularly there is an allotment for the Northeast and for the tribal and the other communities of the church, Catholic Church. Please promote our own children and sisters and priests also. They increase the seat for the sisters. 26 used to be every year. Now 5 more we increase because lack of doctors in the health centers. And today we call it as like hub and spoke model. With that we are trying to sustain the health centers. We have, as I said, sisters as doctors. Today we have priests as doctors, 8 of them. Only one was the priest as a doctor. Today we have 8 of them. In the Chameleon priest congregation, there are 5 of them. and in Vincentian one, Capuchin one, and Redemptorist one. Altogether 8 of them are there. Out of those 8, 4 of them joined as doctors. Doctors then joined the seminary and then they became priests. And I just keep telling today that why not sometimes in the seminaries also I just started to tell, and also Bishop also has sometimes address and say, if a person, if a brother, a candidate wants to be a doctor, why not he can be? Please promote. This is how we are trying to tell. And of course, our laity, in a good number, we have the doctors, and in the days to come, we have to promote, and we need to have more and more health care workers. Something about the financial sustainability is the biggest challenge. Most of our health centers are struggling. Lots of external funds have been closed because of the strict rules. But I tell you, in this world, there are people of goodwill. Only we'll have to make efforts. Our healthcare institutions have to see how we could mobilize funds. We were easily thinking that funds should come. Somebody else helps us to help us. Abroad, foreigners have to help, or people should come and donate us. No. Today we will have to find out different strategies how we could mobilize funds. And there are today called CSR funds. Our health centers have to tap the resources of the CSR, Corporate Social Responsibility. Every company has 3%, as most of you are aware. Only you will have to go and ask. And for that, what we really require is today is compliances. I and Bishop were just discussing. Also, our health centers need to have all the compliances met. All the records are in place. We need to put our house in order. And then, I think, we are the people who are serving. We should not be afraid. I have started keep telling all the healthcare workers, do not be afraid. Afraid for whom? Afraid to whom? Finally what? Behind the bars? Be there. There also food is provided. There is also little place to sleep. And finally, you will be the person, one who is the committed person given your life for this cause. Do not be afraid to do the good will. Everyone knows the healthcare work that we do with lots of commitment. Many of our health centers suffer with the growing cost of the drugs and consumables. We'll have to only again find strategies how that we could take from the people of who are good donors and help us. The technology, you are aware, growing so much with the AI and all that now. Now our health center, I found in some remote areas, not even 2 or 3 computers they would have. But at the same time, we should not, none of the days to come, as I said, we have to be very professional. At the same time, we have to be also pastor, and we need to remember our apostolate. But we need to be also professional. Therefore, we have to adopt the technology as much as. So our health centers in the days to come, as in the beginning, in the council said, all with the support and care that was providing. It's not between the 4 walls, but we will have to extend the paradigm shift that we are saying. The church is the one pioneered in helping the people who were infected with leprosy, people who were mentally ill, the people who were HIV/AIDS, who were infected and affected. Take any chronic diseases or the life-threatening diseases, church jumped in quickly and helped. People, government and others, they may recognize or they may appreciate or not. We are not waiting for that, right? But we need to do. Somewhere when we do this paradigm shift, I think we need to keep telling others our stories. Very poor we are in the Catholic Church. We are very poor in telling what we do. What we say during the Lent, what your right hand does, let your left hand not know. Correct? No? So that at the same time, what we do also we have to keep telling. So that people may find in us the good works done and may come and collaborate with us. And I'll tell you, we should never take the society very negatively at all for anything, for any rules and regulation that comes. Only we should say, we have some strategy to work. We know how to work. We know how to give love. We know how to give compassion. We know how to give care. And that is something different than others. As a Christian, as a Catholic, I know how to do that. Whatever may be the difficult, whatever may be the rules and regulations, whatever may be the laws, in that I will find that I give care and support with love and compassion which others cannot give. Something that is different. And therefore, let us not forget to touch the people who are not touched. Only the church taught to the society and to India that even the person one who is neglected and thrown out in the field is picked up and brought and given him life. That was for the leprosy those days. Even people who were persons with HIV were thrown, were never even, those were the days, you know. And we are the people who showed, no, it is not the one. We mean the life. We give value for the life. Therefore, we have taught and we have been to keep doing that. Therefore, that shift, care and support, we should never forget in our health care. It's not only the medicine, much more than beyond that. What more we can do, we have to keep thinking in the days to come. Collaboration with the government department. I'm very happy. Here, Jane, IM, I think, and RIMS, right? RIMS. And many of you are Catholics and Christians working with others. I know for sure that you light the light there. Your goodness is always shown there, bloomed there. Thank you for all that. We salute you for all the work that you do with all the people, particularly in Manipur, with everyone. Thank you for all that beautiful work doing. We have to keep doing, working with the government, departments, healthcare departments, and with the government closely as much as. The church has to, in the days to come, collaborate and work as much as. Find what programs that we could do and how we could collaborate. And for that, a good rapport that we have to build. We are always good in building good rapport, but we'll have to only make up our mind that I will go out of my health center and do it. This is what we'll have to show and do. Working with every denomination. Today, it's not only the Catholic Church, we say, there are around 280 hospitals. CMCI has Christian Medical Association of CMC Vellore and all. There is EHI also. They have around 30 or 40 hospitals also. There are other denominations also in the healthcare. We are all together more than 4,000 healthcare institutions in India by Christians in the name of Jesus. And you know, we are the second after government with the healthcare support in India. But only we have, somewhere we are lacking is that we are not able to show what we are. And what is that? Till today we have not given importance of further data. Collect and tell. Today government also asked me, Father, tell me last year how many of the persons with the tuberculosis were treated by the Catholic Church, including all of us. I do not have the data. Therefore we said, not required. We serve, we don't tell others. No, that is an attitude. No, it doesn't work in the days to come. We will have to have the data. We will have to have the documentation. I say, work professionally with the tone of apostolate and care and support. That we need to do. We have to speak to the government, sit and say, this is what we do. I'm sure government is very much aware, but we are not able to say it. Because why? Government need to know. We need to collaborate and work. Many of the challenges the church has worked together. And none of the challenges are seen as a hurdle that stopped our work. Never. We never stopped working. Never stopped taking care of the sick till today. Therefore, Bishop was telling me, we have to keep doing. However, whatever it is, keep doing it more and more. More and more. True disciples as Jesus. That we till our life. We keep, because that is burning in us. Nobody can remove from us. Whatever the rules, regulations, punishment, penalties, finding fault in us, nothing can harm us. Because that light that Jesus has put in our heart is burning forever. Goodness and good things we keep always doing. Therefore, healthcare is more than a profession for us, my dear brothers and sisters. It's a vocation of service, compassion, and healing that reflects the love and mission of Christ. In spite of the various challenges, some of the healthcare centers have evolved successful models to sustain themselves and thrive, continuing to provide healthcare to the poor and marginalized in spite of these challenges. We will strive collectively. This is what I have just wanted to tell you, all of you. And prophetically, let us not be afraid. And respond to the specific demands of the healthcare needs of the people according to the teaching and example of Jesus the healer. Once again, I thank you for all the committed work that all of you do. Let us keep doing all that is. If we find somewhere we have to do more, give it start or activate and do it more. Join together, and that will allow us to show Jesus is the true healer, that He has made me a healing healthcare personnel and a professional, and He has given me an apostolate that I will keep doing. Nothing will stop me. Nothing will stop me in this world. And this is the way that I give Jesus to others. So with these words, I just stop. The last verse of Jesus, the first form of care needed in any illness is compassionate and loving closeness that you all do. May God bless all of you. Thank you so much for all hearing me in this, as I said. Thank you so much.
As in the Matthew 10, it says, Jesus instructed His disciples to heal the sick, raise the dead, cleanse lepers, and drive out demons. Likewise, dear Reverend Father Ivan Santosh Diaz, your insightful words help lead us closer to God. May God bless you, and may you continue to be a guidance for us all.
There's a place in your heart, and I know that it is love. This place, much brighter than tomorrow. And if you really try, you'll find there's no need to cry. This place, you feel there's no heart of sorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. If you want to know why, there is love that cannot lie. Love is strong, it only cares of joyful giving. If we try, we shall see. In this place we cannot feel fear of dread. Stop existing and start living. Then it feels like always love enough for us growing. Make a better world, make a better world. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. Make a better place for you and for me.
The priest, Most Reverend Dominic, the Archbishop Emeritus, Reverend Father James, the Director of CMC, Father Santosh, Ivan, for a beautiful message. Reverend Father Burkis, the Vici of the Archdiocese of Imphal, Reverend Father Paul, the Chancellor, Father George, one of our pioneer fathers, sisters, and you, my dear lay people, especially doctors and who are working in healthcare. I want to take this special manner to wish all of you a very, very happy Jubilee year. We all can stand up, I think, because we have sat for a long time listening to Father. Let us all stand up and give a rousing applause to our doctors and health workers. Thank you so much. Please be seated. Then we have Jesus who came to this earth and lived like us and went through passion, death, and resurrection to reconcile us once more, sinners, back to God. And so, in a way, to give us back the dignity of human life, human person, through his death and resurrection, restoring back which the sin had destroyed to God and among us. These two lay the true foundation of our understanding of moral and ethical practices of healthcare professionals. With these two put into place, I will not go for further explanation. You already know this one. There are several areas based on this which we Catholics, be it in the health work, be it social workers, be anyone who is engaged in our day-to-day living, these two are the foundational ones. Today is special for our doctors, health workers, because today the Church is reminding us that you have a special mission. And if you go back to Lumen Gentium, you will come across that the mission of the lay people is to sanctify the secular world. You as doctors, nurses, health workers, you will be sanctifying our world through your service to the sick people, those who are in need of your care. And that Father had brought out very well, saying, you are to show Christ to the sick, not only to the sick, but to the world. And that's one important point that we need to keep, that you have this mission of sanctifying our world, secular world. Father also said, very few priest doctors, very few sister doctors. Majority of doctors are you, our lay people. You are the ones who are in the forefront. You are the one in the villages. You are the one in the cities. You are the one who are handling the sick, both critical ones, at the same time some light ones. You are the ones who are handling the technologies. You are the ones who are checking the sick persons, using all the modern technologies that are available and that are being growing day to day, every day, more and more. And every situation that is brought, new understanding, principles, laws to be taken into account, and also to review, not review in a sense, to refer the understanding of the principles of the Church, the value of human being, and those principles which are very vital for your practice in your practical field. I will present you a few of these ones, but I will not explain much. Maybe sometime when we have seminar or so, we could explain, we can have interactive sharing, where you can present your cases that you come across in your medical practice. In the first place, let's go to foundational ethical principles. These principles which I am presenting to you, which is the practice of the Church and also in the society, is also based on these foundational truths that we are created in God's image and likeness. And so the value of human being is underlined in this principles. In the first place, this is not a class, and you must have taken the class in a class already, but a reminder for you. In the first place, respect for the autonomy. That means the right to be well informed to the patient about the treatment you are giving, about the sickness or diseases he or she has. And also get the consent, informed consent, not just consent, informed consent before a treatment or procedures are carried out. This one is very important. This is based on human dignity again. And that human dignity is based on the fact that we are created in God's image and likeness. Second, beneficence. That is, you have to act for the patient's best interest. For the patient's best interest. And recommending the treatment which are proven, not simply innovative without properly knowing. It should be something proven practices. These are the first things you are supposed to do. Third, non-maleficence. And that is, do no harm. Your principle, your interest will be, do no harm to the patient, to the one who comes to you. Avoid unnecessary risk or interventions, which in normal standard we are not supposed to be. Avoid that. Then the fourth one, justice. Ensure fairness in healthcare, especially accessing the healthcare, resource allocation, in all this, practice justice. During the COVID-19, we are told that some of the medicines, the rich countries hoarded for themselves and deprive them to the poor countries. Or they do this not to allow others to have easy access, or sometimes the price is so high that the poor are not able to access the treatment they are in need of. These areas need to be taken into account, because you need to practice justice in your treatment towards the sick or those who are in need of it. Then this is further checking about what I have just presented to you. Key ethical practices in medicine. Key ethical practices in medicine. Again, informed consent of the patient, which is important. Clearly ask or tell the sickness. Clearly tell or explain the risk that will entail in the treatment. Clearly tell the benefits in the treatment. Also tell the alternative of the treatment. These are important part of this so-called informed consent. And in this interaction, to find out the real sickness and to explain properly, then we also need to have a little background of the person and the language of the person. Half and half you understand, and half you try to explain, and the person do not really understand. That should not be. That's why interpreters are also to be called in, so that you explain them in a way that is understandable to the patient. Then confidentiality. You have the data of the sick person, the kind of sickness. which the patient would not like to share with others. And you must respect that confidentiality of the sick person. Only in exceptions, for example, like reporting diseases, infectious diseases, which are risky to others. At that time, there is a legal allowance. Otherwise, you are to respect and protect the privacy and confidentiality of the person, the sick person. Then, professional integrity, or I would call it boundaries, keeping boundary. Professional integrity implies avoid conflict of interest. Don't take decisions for the sick person based on your interest or the influence of some of your family members or your own benefit, but for the good of the patient. This is a little sensitive here, no? Because there's a play of my gain, there's a play of someone is informing, someone is having pressure. You are to give, to what we call avoid conflict of interest. Financial things are involved here. That's why it is a little bit sensitive. You have to be very careful in this. Also, there are cases where the patient and the doctor or nurse or get involved in a romantic friendship, romantic relationship. In such situation, it is important to, from the part of the officials, to separate this provider, who send to another provider to prevent this problem, because it can be harmful to the patient and it can damage the image of the doctor or the caregiver. And that's why avoid this one. Fourth, end of life care. End of life care. These are cares when the sick person is in his critical or her critical state. How do we treat them? Number one, respect advance directives. Supposing the sick person had already told, I don't want to be treated anymore, for example, I don't want any more treatment. That's one point. And another is, should we give euthanasia? Should we practice euthanasia? Should we give palliative sedation? These are also points where it comes to play in this area. End of life care. Is in this situation, we have to respect the advanced directives of the sick person. Sometimes family pressure also comes into play here. We have the story of Schiavo in Italy, I think, years ago. The family would like this fellow to continue, or he had already said, don't give treatment anymore, I'm ready to die. When there is conflict here, what should it be? We give the principle that the directive of the sick person be respected. At the same time, we must also look into whether we can help him out. And in this, we need a sympathetic dialogue with the person to help him prolong life or live a dignified life, rather than to allow him to die. And so here, the important thing is to patiently talk over, if need be, follow or involve mediator. It could be a chaplain, spiritual chaplain, or it could be an ethical committee. The important part of ethical committee in hospital comes here very strongly. I don't know we have or not, but these are an important institution within hospital for the best care of the sick persons. And so in the dialogue with the patient, we also have to check that the legality of the patient's direction, whether it was still valid, whether it was taken with clear mind or not. These things has to be taken. So it has got certain procedural point where we have to ascertain that the one who had given the directives was done, that he had done it in clear mind, and that his directives is still standing. Then only the respect for his direction is given priority. Let's go to the next, fifth, cultural competence. Respect for diverse beliefs. One clear example comes in the story of blood transfusion. And blood transfusion is not allowed in the SDA, Jehovah Witnesses. They don't allow. Do we respect him? Or do we have to involve? Clearly, if transfusion is not given, what are the alternatives prescribed? And if it is not given, he or she would die. Should you allow it? Those caregivers must here again dialogue and try to make the patient understand this area. And if there is no way for him to take into consideration, look for alternatives. Then we can also involve the family members in order to win over for prolonging his life for treatment. If there is no way, then respect for the will or the belief of the person will be the final. These are very risky and complex issues in your life, in your practice of medical practice. The challenges, ethical challenges in today's world, we are faced with use of new machineries. We are faced with AI, artificial intelligence, then genetic interventions. All these things come here. What are the things we are to take into account? In the first place, on this area, resource allocation. Sometimes in a hospital, you have no ICU. ICU is packed. But among the ICU members, there are better ones, and there are others waiting who are very critical. Whom should we give? Or your own family members come. Whom should we give? Justice will come to play here. Justice will imply that those who are in need more be given the privilege. There were cases during COVID time that those who are sick, especially old fellows and young fellows, post COVID patients. Whom should we give priority? This also was one of the debated issues in the world. In Italy specifically, they say we must give priority to the young ones because old ones will die soon. There is no specific rule here. One has to discern according to the situation, but life, prolonging life and protecting life must be given the priority. Sometimes there are bias in AI technologies, especially diagnostics. Especially there was a case when the AI was given priority only for the white people. The black people were denied AI treatment. This is called bias practice of this AI technology used in the healthcare. And so the minorities were prevented from getting the privilege of AI practices. Another important area is when AI or these machineries are used, the report is often open. And that's why, again, the importance of confidentiality comes to play. That confidentiality must be maintained even in this area. The problem in this area is sometimes some people get this AI diagnostic advantage, but this does not mean that human intervention should not be there. That's why AI plus human intervention, the two must be there, because we are human beings and machine does not replace the care given to the sick. That's why only machine understanding should be avoided. That's what today in the new contemporary ethical challenges they advise. Let's go to this important point. Technology should augment in the treatment, but they should not replace clinical judgment. Human judgment and human care should not be avoided, should not be replaced by technology. Genetic testing is one of the important areas today. When these things take place, there should be no discrimination practice. If there is a great risk, the confidentiality of the sick person should be maintained. If sometimes a patient would tell, please don't tell anyone, I am HIV, don't tell my parents or friends. What shall we do? Shall we respect that advice of the patient? According to the principle, priority is to be given to the will of the person, right? But in this case, this is one case I'm just bringing, okay? In this case, this fellow will be the cause of many more HIVs, right? And that's why here, the family members, be it needed or not, or the community needs to be known. Otherwise, the disease would be being spread by this person. This part is very relevant with regards to one special sickness called Huntington's disease, which I don't need to explain to you right now, but it's a peculiar disease which can affect other family members. Also, the sickness can be in some way helped out when diagnosed early, with all the care and the family surrounding knowing for better care for this particular sick person. Then the fourth one, global health equity, which implies that addressing disparities in healthcare access between high and low income countries. This is at a universal level that I have already mentioned in one of this area, that the healthcare must be accessible to all, not based on income. Those rich fellows could have the best, poor fellows could not get. And so this also calls for lowering the price of treatment or the price of the medicine so that it is available for the well-being of even the poor people. Then clinical trials. Here also informed consent and avoiding exploitation should be done. For example, there was a pharmaceutical company who conducted a trial for new HIV drug. And people in Africa were given this medicine for trial without proper information and without proper compensation. Is it okay? Will that be okay? It will not be okay, no? So this kind of bias, this kind of exploitation should not be there. If in a small area, in your small medical center, if this thing is there, you as Catholic should not practice such. In all these clinical trials, international guidelines, which is declared in Helsinki Declaration, ensure the participants' risk and make them understand the risk, and also must allot reasonable or fair compensation for those who go through. Then, addressing ethical dilemmas. Some things which we come across which confuses us, which one is confused as to which one to take. Certain procedural positions or helps will give us necessary step to clarify and do the needful. In the first place, there is a need for ethics committee in every hospital. Hospital-based multidisciplinary teams that review complex cases. Example, withdrawing life, end of life point. These things must not be taken by one person. It should be properly discussed and properly, maturely taken proper decision for the well-being of the student, not student, sick, and for the good of all. Second, the need for doctors, medical workers, nurses to continually study and update himself or herself, not being satisfied with what we learned 10 years ago, but every time be ready to update. That's why we need magazines that gives this knowledge. And doctors, nurses must get into this, updating one's knowledge or education. Another important area of what we call addressing ethical dilemma. The one is whistleblower. Let's take one example. A nurse see a doctor, a surgeon, constantly in the operation theater, half drunk. What to do? He is not in full mind, but he is doing the operation. And he is endangering the life of the patient. You are one of the team member. What should you do? If you tell openly, your work may be terminated. But if you don't do that, the sick person or the victims may be being harmed, if not killed instantly. What is the way you should do? There are certain procedural practices in our world. One, your important influences non-maleficence. That means protecting the patient from being harmed. This is your role, no? And so that is important. But we have got another important area. Personal risk of your job, losing. And you are wondering what to do, which side to do. But you have to do one thing, important thing. Otherwise, you are harming both. And so here, sometimes there are hospital compliance channel. Some complaint box, something like that, no? Father will know about this one better, you know. Without putting name of yours, revealing, put in this kind of complaint area for the administration to know what's going on. But don't put your name, okay? It should be caught, no? Also, whenever you see this, document the evidence, the day on which surgery was conducted, and who were around the witnesses. Not only you, keep that one in your record quietly. Because when the case comes, you have to have evidence to stand for you, to protect you. And then legal protection may be applied for the person. This is for non-maleficence, to save, not to harm the patient. That is your, what you call your priority. So these things could be done. Now, if you don't follow some of these ethical practices or behaviors, things can happen. You either cause harm to the sick patient or other things like loss of trust. People will not trust you anymore. As you practice, you are supposed to gain trust of the victim or the patients so that their health is better, and that you also give your best to them. And so trust of the patients should not be eroded. And so you have to follow ethical behavior practices and not unethical practices. Second, unethical behavior which leads you to legal repercussion. Someone can sue you if you don't follow these standard procedures. Third, he may harm to the patients, physical, emotional, including spiritual. These are few consequences of unethical behavior which calls that if you want to gain trust of your patients, then you follow certain principles, that given principles of the church and of this profession. I would like to stop with this one because so many other complex issues are there. It's not the right time to go on giving all those, but these few principles I would like to place for you. What Catholic moral, ethical practices Catholic medical officers should follow.
Smile.